Hi, Dr. Ray. So this is Tank 14's donor program project we had to do. So in my tank is Anthony, Billy, Colleen, and myself. So our patient was an 87-year-old Asian female, and we did find out that her career was that she was an artist. And so the pathology that was on the report itself was native coronary artery disease, which we'll end up talking a little bit more about throughout it. But there was nothing that necessarily indicated that that is exactly what happened. So we figured that it was just something that was put on there because we did not have the cause of death. So you did have us weigh the organs, so kind of just running through the weights. The liver was 1.566 grams. One lung, the right one, was 1.298, and the left lung was 1.430. Her spleen was 0.358 grams, and her kidneys, her right kidney was 0.19, and her left kidney was 0.154. The brain was 2.212 and the heart was 0.524 grams. And since native coronary artery disease was on the paper itself, we were kind of expecting to see more things when it came to her heart, but there wasn't anything specific that we noticed necessarily. There was no evidence of bypass, and we did end up finding out that she was right heart dominant. Some notable observations that we made. Our cadaver was obese, and some of the other things that we noticed was that she had a paraesophageal hiatal hernia, which whenever we had people come by, they most likely said it was just because of older age, but of course we don't know the cause for sure. We did find a staple in her greater omentum, so that obviously was indicative of surgery, but we didn't necessarily know what surgery it was. Her right kidney was atrophied, and it was significantly smaller than the left one. We didn't originally notice it because it was packed around by so much fat, but once we ended up tearing the fat away, we kind of noticed how much smaller her right one was than her left, but they were both pretty small for size. And then the past surgeries that we did notice were that she had an appendectomy, and she also had her gallbladder removed. Okay, so we kind of went through each of the surgeries she had and kind of talked about some of the things that could cause the surgery or some facts about it. So like we said, she had her gallbladder removed. So the potential reasons for the surgery or having it done is cholelithiasis. She could have also had a stone in her bile duct itself. She could have had cholecystitis, which obviously is that we now know is inflammation of the gallbladder, or it could have been secondary to pancreatitis as well. So the hiatal hernia that we found, like I said, most people that came by ended up saying that she basically was a risk factor herself for having one. So over the age of 50 is a risk factor, as well as being obese. And she was obese, and like we said before, she was 87 years old. So the causes of the hiatal hernia, besides her risk factors that were very evident, is persistent and intense pressure from the surrounding muscles, such as while coughing or vomiting, straining during a bowel movement, exercising, or lifting heavy objects, trauma, or certain types of surgeries. So obviously, we don't know her activity level or anything like that. And her being an artist, she probably spent most of her time sitting. So we couldn't really give a reason as to why we thought she had the hernia, besides her risk factors that were there. She also had an appendectomy done, and appendicitis is the most often cause of why you would have one removed, and it usually happens between the ages of 10 to 30. So we obviously don't know what time she had it done, but those are the ages that normally that type of surgery occurs. And the treatment for appendicitis is obviously the removal of the appendix. And over 5% of the population develops appendicitis at some point. So the causes of appendicitis, which obviously then leads to an appendectomy, would be blockage in the lining of the appendix, causing an infection, bacteria will multiply rapidly, and that will cause the appendix to be inflamed, swollen, and filled up with pus. And so obviously the goal is to have it removed before there's any rupture. Like I mentioned before, her kidney, both of them were smaller than we expected them to be, but her right one was significantly atrophied. But there was no evidence otherwise to support that that may have been a cause for her death. We had people come by and they noticed the size, but other than that, there wasn't anything that said that her cause of death would have been renal. But it did indicate that she probably had some poor function, and at her age, that wasn't very surprising. So the conclusion, like I said before, on our paper that we were given at the very beginning of the semester, said that she passed away from native coronary artery disease. But when we looked at the heart, we didn't see any signs of ischemia or an MI or anything like that. We did notice some calcification of the valves, and I want to say that it was the aortic valve that we kind of noticed the most calcification on. But it wasn't anything that was super significant. It just kind of looked like it wasn't functioning as properly as it could have been. And so the presented pathology that we saw on her heart didn't necessarily lead to why we thought she passed away. So we figured native coronary artery disease was just the answer that they put if you're not really sure what happened, or if it was because of old age. So our suspected cause of death and what we kind of decided was old age itself. And of course that is there's a lot of contributions that come into that, but we kind of tied together that her kidney poorly functioning could have a lot to do with what occurred. The poor cardiac output due to the calcification of her valves could also have a play, especially since she was 87. And then also she was very obese, so any straining that she may have had to do, or overexertion of mechanics could have been another cause of why she was having such a difficulty time doing things. So here are our citations, and that is all we have for you.